All right, let's dive right in, shall we? We've got a ton of notes and excerpts here, and it looks like it's all about cancer.
That's right.
Our listener is getting ready for a nursing course, an oncology course by the looks of it. So we're going to try to get a good handle on cancer, how it works, the types, the treatments, that whole thing.
Yeah, by the end of this, I think you'll have a really solid foundation for that class and probably learn some pretty interesting stuff about cancer, too.
So to start off, what exactly is cancer? I mean, we hear the word all the time, but these notes say almost half of Canadians will face a cancer diagnosis in their lifetime.
Yeah.
That's a lot of people.
It is a staggering statistic, and it's really largely tied to aging. Most of those diagnoses happen after the age of 50, but it's not just a disease of the elderly, though.
Right.
Some cancers like breast cancer, lymphoma, sarcoma, melanoma, those are more common in people under 65. And we're even seeing, colorectal cancer becoming more common in younger people.
Yeah. And then there's this whole thing about benign and malignant tumors. These notes actually have a really great table that kind of breaks it down.
Oh, that table is such a good visual, right?
Yeah.
Knowing the difference between benign and malignant, that's super crucial. So benign tumors, those are well-behaved house guests. They stay put and they don't cause a ton of problems.
Yeah.
Malignant tumors, on the other hand, those are the unruly party crashers. They come in, they overstay their welcome, they start messing with everything around them.
Yeah.
And the worst part is they can spread to other parts of the body.
Right. That's metastasis, right?
Yeah.
The idea of cancer cells spreading is just, it's scary.
It is scary.
It's like a sci-fi movie where these cells just kind of break off and set up shop somewhere new.
It's almost like dandelion seeds, scattering in the wind. Each seed could take root and form a new dandelion in a different spot.
Right.
So it's kind of like that with cancer cells. They can sneak into the bloodstream or the lymphatic system and then set up camp in a whole other organ.
Yeah, so how does a perfectly normal cell become this rebellious cancer cell?
Mm-hmm.
The notes compare a cell to a tiny machine with this very specific process for growth and division.
The cell cycle, right. It's like a set of rules that cells follow so that they can grow and divide in a really orderly fashion.
Right.
But cancer cells, they toss out the rule book.
So they just start growing and dividing uncontrollably.
Exactly. They lose something called contact inhibition, which is we all have a sense of personal space.
Yeah.
And normal cells have that too. They know to stop growing when they bump into their neighbors, but cancer cells, they just keep pushing past those boundaries, piling on top of each other.
It's they forget to be polite.
Right.
And then there's this whole telomerase thing, this enzyme that makes them basically immortal.
Yes, telomerase, yes. Every time a normal cell divides, its telomeres, you can think of them like the little protective caps on the ends of chromosomes.
Okay.
Those get a little bit shorter every time. And eventually they get so short that the cell can't divide anymore. It's like a built-in expiration date.
Right.
But cancer cells have figured out how to cheat death.
Yeah.
They activate this enzyme telomerase, and it keeps those telomeres from shrinking. It's like they found the fountain of youth.
Oh, wow.
They can just keep dividing and dividing.
So this whole process of a normal cell becoming cancerous, it's not an overnight thing.
Right. You're right. It usually happens in stages. Initiation, promotion, and progression. So initiation is kind of like that first hit. It's the initial damage to the cell's DNA.
Okay.
Then comes promotion, where certain factors can speed up the development of cancer.
Like what? What kind of factors?
Well, things like smoking, a diet that's super high in fat, excessive alcohol use, all those things can kind of act like accelerators, really pushing those damaged cells down a path towards cancer.
Oh.
And then there's something really fascinating called the latency period. That's the time between that initial hit to the DNA and when the disease is actually noticeable.
Okay.
And it can vary so wildly.
Oh, wow.
It's different in everybody.
That's kind of unsettling. So you could have this process happening and not even know it.
Exactly.
There's a diagram here that shows the common sites of metastasis.
Yeah.
And it's scary. Certain cancers seem to have these favorite organs that they like to go to.
It's true. And why some cancers prefer certain organs over others, it's still kind of a mystery.
Right.
But it has to do with the tumor's microenvironment and these things called receptors and growth factors.
Okay.
It's almost like different cancer cells have their preferred zip codes.
Right.
So take, for example, colon cancer. It often spreads to the liver. That's because of the blood flow patterns between the two.
So it's not just random.
Not exactly, no. And don't forget, for metastasis to really happen, those rogue cells, They have to build their own supply lines, essentially.
Okay.
And that's where tumor angiogenesis comes in.
Okay.
It's when the tumor actually hijacks the body's blood vessels and creates its own network
Oh, wow.
to get all the fuel and nutrients it needs to keep growing and spreading.
It's almost like these cancer cells are like masterminds, like figuring out how to manipulate the body's systems to survive.
They really are.
It makes you wonder, like, how does early detection even work if they're so stealthy?
Well, that's where knowing your own body and paying attention to unusual changes is super important. The notes conveniently lay out the 7 warning signs of cancer with this acronym, SAUCHN.
Oh, okay. What is that?
So C is for changes in bowel or bladder habits. A is for a sore that doesn't heal. U stands for unusual bleeding or discharge. T is for thickening, or a lump in the breast or elsewhere. I is for indigestion or difficulty swallowing. O stands for obvious changes in a wart or mole. And finally, N is for nagging, cough, or hoarseness.
Oh, okay. Caution. I'll remember that.
Yeah, right. It's a good mental checklist for your body.
Yeah, reminding us to pay attention to those subtle hints. I
Yeah.
remember my friend noticed a mole on their back that wouldn't go away and turned out to be skin cancer, but thankfully they caught it early.
That's the key. Early detection can be life-saving.
Right.
But the process of actually being diagnosed,
Yeah.
that can be a roller coaster filled with so much anxiety and uncertainty for the patient.
Yeah, I can imagine. Like just hearing the words "you have cancer," that must be so hard to process. And the notes mention all these tests, like blood work and imaging and scopes and biopsies.
It's true, there are a lot of tests. It's like detective work. You're gathering all these clues from different tests to really get the full picture of what's going on.
Right.
But the gold standard for really definitively diagnosing cancer,
Yeah.
that's the biopsy. That's the only way to be 100% sure if there are cancer cells present.
Okay. And once you have that diagnosis, how do the doctors determine what kind of cancer it is and like how far it's spread?
That's where the cancer classification comes in. So we look at the anatomical site, that's where the cancer originated.
Okay.
The histological grade, which is how abnormal the cells actually look under a microscope.
Okay.
And the clinical staging, which is really the extent of the disease.
Right.
You can think of staging as a way to assess how far those dandelion seeds have scattered, so to speak.
So it's not just about knowing the type of cancer, but understanding its like personality, like how aggressive it is, how far it's traveled.
Precisely, yes. And that information is really what guides all the treatment decisions.
Okay, well, speaking of treatment, the notes mention surgery, chemotherapy, radiation therapy.
Yes.
Then there's biological and targeted therapies, and bone marrow transplant. That's a lot.
Right. It is a whole arsenal of weapons, and they're all so powerful in their own right.
So surgery is often the first line of defense.
It often is, especially if the cancer is caught early.
Right.
Surgery is so versatile, it can be used for diagnosis, staging, to remove the tumor, even to prevent cancer in high-risk individuals.
Yeah. There's a diagram here about surgical margins.
Yes.
It seems like getting these negative margins where all the cancer is removed, that's like the holy grail of surgery.
It is. Positive margins mean that there might be a few of those straggler cancer cells left behind, and that can increase the risk of the cancer coming back.
Oh, gosh. So chemotherapy seems to be like the big gun, especially for blood cancers like leukemia and lymphoma.
Chemo is powerful stuff. It targets rapidly dividing cells,
Right.
which is great for killing cancer cells. But unfortunately, sometimes some healthy cells get caught in the crossfire.
And that's what worries me. The notes mention bone marrow, the lining of the digestive system, hair follicles.
Yeah.
That's why hair loss is such a common side effect.
It is a trade-off. But oncologists are always trying to find ways to minimize those side effects.
Yeah.
And one common strategy is using a combination of different chemotherapy drugs. It's called combination chemotherapy.
Okay.
Each drug has a different mechanism of action and a different toxicity profile. So it's like a multi-pronged attack, hitting the cancer cells from different angles while trying to spare the healthy ones.
Right, like a 1-2 punch.
Exactly. And then the notes also talk about cell cycle specific and cell cycle non-specific drugs.
Yeah, what does that mean?
Some drugs work best when the cells are actively dividing, while others are effective regardless of what phase the cell cycle is in. Choosing the right combo, that's key. And then, to get those drugs to the source, we often use central venous access devices, or CVADs.
Right, the lecture goes into detail about those,
Yeah.
like PICC lines, tunneled catheters, and implanted ports. It sounds like they're super important for patients getting chemo to deliver those drugs right where they need to go.
Yeah, think of a CVA like a superhighway directly into the bloodstream, delivering those powerful chemo drugs right where they need to go. But just like any highway, you got to keep it clean and clear of any traffic jams.
Okay.
Like infections or blood clots. That's where really meticulous care and surgical asepsis are so important.
Right. So those side effects from chemo, they're no joke. Like
Mhm.
myelosuppression, nausea, vomiting, mouth sores, skin reactions, lung problems, even reproductive issues.
Yeah, it can be really tough, but remember, the whole point of nursing care is to really help the patient manage those challenges.
Right.
We teach them how to manage symptoms, we watch them carefully for complications, and we offer emotional support throughout the whole process.
And then there's radiation therapy, which sounds like a more targeted approach, like zeroing in on a very specific area.
It is. It's like using a high-powered beam of energy to just zap those cancer cells.
Okay.
And it can be delivered from outside the body, like external beam radiation therapy, or internally using implants.
Oh, wow. So, and then they're the like new kids on the block, the biological and target
Yeah.
therapies. It's almost like science fiction, right?
It's pretty amazing.
Manipulating the immune system to fight cancer or designing drugs that specifically target cancer cells.
There are huge breakthroughs in treatment, offering more precise and potentially less toxic options for patients.
And finally, there's bone marrow transplant, which just sounds really intense.
It is an intense procedure. It's often used when other treatments haven't worked.
Okay.
Essentially, you're replacing the patient's damaged bone marrow with healthy stem cells, which can come from the patient themselves.
Sorry.
That's called autologous. Or it can come from a donor, which is allogeneic. Or in some cases, from an identical twin, and that's called syngeneic.
Wow. Okay, so we've covered the basics, what cancer is, how it develops, and the main ways to treat it. It's a lot to process, but it's fascinating how science is constantly coming up with new ways to fight it. Now, let's get into some specifics, like looking at the different types of cancer.
Sounds good. Let's start with the big one, lung cancer.
Okay, yeah, lung cancer is a big one. It's the leading cause of cancer deaths in Canada.
It is, and the stats are pretty sobering.
The notes talk about the link between smoking and lung cancer,
Right, which is undeniable.
but they also mention things like asbestos and radon gas.
Yes, exposure to those can also increase your risk.
Okay, and then there are the different types of lung cancer, right? Like non-small cell and small cell.
Exactly. Non-small cell is more common, but small cell is known for being more aggressive. It's like there are subtypes within lung cancer itself, each with its own unique challenges.
Right, right. And one of the scariest things is that symptoms often don't show up until it's already pretty advanced, right?
Unfortunately, yes. We're talking persistent cough, chest pain, shortness of breath, coughing up blood, things people might just brush off as a cold or bronchitis at first.
That's so scary. I actually knew someone who had a cough that just wouldn't go away for months. They thought it was allergies, but it turned out to be lung cancer.
It happens more often than you'd think. And then there's the risk of this serious complication called superior vena cava syndrome, where the tumor actually compresses a major vein and that causes swelling in the face, neck, and arms.
That sounds awful. So how do they actually diagnose lung cancer?
Well, imaging studies are crucial, chest x-rays, CT scans. But to confirm the diagnosis and figure out what type of lung cancer it is, they still need to do a biopsy.
Okay, so I'm guessing the best way to reduce your risk is to, well, not smoke, right?
Absolutely. Quitting smoking is the single most effective thing you can do to prevent lung cancer. And for those who are at higher risk, like current or former heavy smokers, regular screening with low-dose CT scans can help catch it early when it's most treatable.
Okay, so we've seen how lung cancer often hides in plain sight. Now let's talk about a cancer that often starts with whispers, colorectal cancer.
Good transition.
Colorectal cancer is the second leading cause of cancer deaths in Canada.
That's right. But the good news is it's often preventable if you get regular screenings.
That is good news. The notes talk about these things called adenomatous polyps. Those are these little growths in the lining of the colon that are actually precursors to most colorectal cancers.
That's exactly why colonoscopy screening is so important.
Right.
It lets us detect and remove polyps before they can turn cancerous.
The list of risk factors is long, though. Age, family history, inflammatory bowel disease, smoking, a diet high in red meat. It's kind of a mix of things you can control and things you can't, which can be frustrating.
That's true, but even if you have some of those non-modifiable risk factors, like a family history, there's still a lot you can do to lower your risk.
Like what? What can you do?
Simple things, really. Eating a balanced diet, maintaining a healthy weight, staying active,
Okay.
All of those can make a difference.
And I guess knowing the symptoms is crucial too.
Absolutely. So things like changes in bowel habits, blood in your stool, abdominal pain, fatigue, unexplained weight loss, those are all red flags. Don't ignore those.
Yeah, so if you see something, say something, basically.
Exactly.
And how do they diagnose colorectal cancer?
Colonoscopy is the gold standard for this one, too. It allows doctors to see the entire colon, take biopsies if they need to, and they can even remove polyps during the procedure.
And if they do find cancer, what are the treatment options?
Well, like most cancers, it depends on the stage and the overall health of the patient. But typically, surgery, chemotherapy, and radiation therapy are the mainstays of treatment.
Got it. Moving right along. Breast cancer is next, and this one affects a lot of women. The notes say 1 in 8 women in Canada will be diagnosed in their lifetime.
Yeah, that's a sobering statistic for sure. But the good news is the 5-year survival rate for breast cancer is pretty high, especially when it's caught early.
That is good news. But there are a lot of variations in breast cancer, aren't there? The notes list non-invasive versus invasive, ductal versus lobular, and even inflammatory breast cancer and Paget's disease of the nipple.
It's true. It can get a little complicated, but each type has its own unique characteristics, and those really influence how it's treated.
The notes mention that hormones can play a role in tumor growth, which makes sense considering that some types of breast cancer are fueled by estrogen.
Exactly. And that's why blocking estrogen can be such an effective treatment strategy for those types.
The clinical signs seem fairly straightforward. A lump, nipple discharge, changes in the skin, swelling in the lymph nodes under the arm.
Early detection is key, like we've been talking about. Regular self-exams, clinical breast exams, and mammograms are the best tools for finding breast cancer in its early stages.
Speaking of mammograms, my mom was a little nervous when she turned 50 and had to get her first one.
That's understandable. It's normal to feel anxious about any screening test, but the benefits of catching it early definitely outweigh the risks.
Right. So what happens after they find something suspicious? What's next?
Well, typically a biopsy is done to confirm whether it's cancer or not.
Right.
And if it is cancer, they'll do additional tests to determine the stage of the cancer, whether it's spread to any lymph nodes. That helps to guide the treatment decisions.
Okay, so what are the main treatments for breast cancer?
Surgery is often the first step. There are options like lumpectomy, which removes just the tumor and some surrounding tissue,
Okay.
or a mastectomy, which is removing the entire breast. And then radiation therapy, chemotherapy, hormonal therapy, and targeted therapies like Herceptin.
Wow.
Those are often used in combination too. Really depends on the specific characteristics of the tumor and the patient's overall health.
The notes mention lymphedema, which is swelling in the arm, and post-mastectomy pain syndrome as potential complications. Those don't sound good.
It's true, they can be really challenging complications, but there are ways to manage them. Physical therapy, compression garments, and good pain management techniques. All of those things can really help improve quality of life.
Okay, good to know. And last but not least, we've got prostate cancer, which is the most common cancer in Canadian men, especially those over 65.
It is. It's another one that often flies under the radar, partly because early-stage prostate cancer often has no symptoms.
So how would you even know if you had it?
That's the tricky part. Screening for prostate cancer can be a little controversial because the most common test, the PSA blood test, it has a high rate of false positives.
Wait, what does that mean, false positives?
It means that the test can detect elevated PSA levels, but they're not actually due to cancer.
Oh, so how do you balance early detection with the risk of, like, unnecessary worry or procedures?
That's the million-dollar question, isn't it? And it's a conversation that every man should have with their doctor.
Right.
You have to weigh the potential benefits of catching it early against the potential downsides of overdiagnosis and maybe even overtreatment.
So it's not a simple yes or no answer.
It's not. It's a very personal decision. You have to consider your risk factors, your family history, and your personal preferences.
Right. So besides the PSA test, what other tools do doctors use to diagnose prostate cancer?
Well, the digital rectal exam, or DRE, that's still an important part of the screening process. It allows the doctor to actually feel the prostate gland for any abnormalities. And if either the PSA or the DRE is abnormal, then a biopsy is usually recommended to confirm the diagnosis.
Okay, so if cancer is found, what are the treatments?
Well, it depends on the stage and how aggressive the cancer is.
Right.
For slow-growing cancers, active surveillance might be an option. That means they just monitor it closely without doing any immediate treatment.
Okay.
But for more aggressive cancers, Surgery, radiation therapy, hormone therapy, and chemotherapy are all possibilities.
Wow. Okay, we've covered a lot of ground. Lung, colorectal, breast, and prostate cancer. It's clear that catching it early and understanding your treatment options are really crucial.
Absolutely.
But there's another piece of the puzzle that we haven't talked about yet, and that's prevention.
Oh, yes, prevention. That's a big one.
I'm all about taking proactive steps, protect our health.
Me too.
So what can people do to reduce their risk?
Well, it all starts with those healthy lifestyle choices. It's like building a fortress against cancer.
Okay, I like that analogy. So what are our building blocks?
Well, first, you got to ditch those bad habits. Smoking, excessive alcohol, those are like cracks in your foundation. They weaken your defenses.
Right, those are the usual suspects.
What else? Fuel your body with good stuff. A balanced diet, lots of fruits, vegetables, whole grains.
So, eating the rainbow, like we always hear about.
Exactly. Load up on that ammunition to fight off those rogue cells. And don't forget, exercise.
Yeah, of course.
That sends your immune system to boot camp, gets it in top fighting shape.
Okay, so we're ditching bad habits, eating healthy, and exercising. What else can we do to make that fortress super strong?
Protect your skin from the sun. Think of sunscreen like armor, shielding you from those harmful UV rays.
Oh, yeah, good point. I'm definitely guilty of forgetting that one sometimes.
And those routine cancer screenings, those are like sending out scouts to catch any signs of trouble early.
Yeah, screenings are so important. I know people who have had precancerous polyps removed during a colonoscopy.
Right.
It's like preventing cancer before it even starts.
Exactly. Prevention can be life-saving, but unfortunately, not every cancer can be prevented. So let's shift gears a bit and talk about what happens when someone gets that diagnosis. They hear those words, you have cancer.
Right.
We're moving into the world of cancer care now. What are some of the things that nurses need to keep in mind when they're caring for patients who are starting out on this really challenging journey?
Okay, yeah, so we're putting on our nursing caps now.
Exactly. First and foremost, you have to remember that a cancer diagnosis can just turn someone's whole world upside down.
Yeah, I can imagine.
Fear, anxiety, uncertainty. It's a roller coaster of emotions.
Right.
So approaching each patient with empathy and compassion, that's just absolutely vital.
Right. It's about recognizing that it's not just a disease you're treating, it's a person.
You got it. It's about caring for the whole person, building that therapeutic relationship, providing emotional support. Those things are just as important as managing the physical side of things.
And it's not just the patient who's going through this, right?
Oh, absolutely. Their families are on this roller coaster too.
Right.
And they need our support just as much.
So the lecture notes talk about some of the common challenges that cancer patients face, like fatigue, anorexia, and nausea and vomiting.
Yeah, those are big ones.
I can only imagine how much that impacts their quality of life.
It really does. Fatigue, for example, that's more than just feeling tired.
Right.
It's this really profound exhaustion that can affect every aspect of their life, like having your energy reserves constantly drained, making even the simplest things just feel impossible.
And then you have anorexia, where they just lose their appetite completely.
Right, and that makes it even harder to maintain their strength and energy. It's a vicious cycle.
It is, and then you add nausea and vomiting on top of that.
Exactly.
Which are pretty common side effects, especially with chemo. Food becomes the enemy.
It really does. Even the thought of eating can trigger waves of nausea.
So how do nurses help patients manage these really tough symptoms?
Well, a lot of it comes down to symptom management, finding creative solutions. So, for example, with fatigue, we encourage patients to alternate periods of rest and activity,
Okay.
finding that balance between pushing themselves and also honoring their body's need for rest.
So it's about moderation, finding that sweet spot.
Exactly. With anorexia, we monitor their weight and their food intake really closely.
Okay.
We can offer them nutritional supplements. We work with dietitians to create meal plans that are appealing and easy to digest.
That makes sense.
For nausea and vomiting, antiemetics are key.
Right. Those are the anti-nausea meds.
Exactly. And we often give those before chemo or even before meals, just to try and prevent anticipatory nausea.
Anticipatory nausea. What's that?
That's when the patient starts feeling nauseous just from thinking about food or treatment.
Oh, wow. So you're trying to stay one step ahead.
We try to. Then there's mucositis and stomatitis, which is inflammation and sores in the mouth.
Yeah, I can imagine that would make eating really painful.
Oh, it's awful. It's like a constant burning sensation. And it increases the risk of infection, too. So meticulous oral care is really, really important.
What does that involve?
We encourage them to rinse their mouths often with saline solution. Use a soft bristled toothbrush. Avoid spicy or acidic foods that can irritate the sores. And sometimes we prescribe medicated mouthwashes to help with pain and healing.
It's crazy how something as simple as a mouth sore can have such a big impact on your overall well-being.
It really can.
The notes also talk about bone marrow suppression, which sounds like another really serious complication.
It is. It's basically the body's inability to produce enough blood cells, and that can lead to anemia, leukopenia, and thrombocytopenia.
Okay, break those down for me. What do those mean for the patient?
So anemia, that means they have a low red blood cell count, so they're going to be tired, short of breath. Leukopenia means they have a low white blood cell count. That makes them much more susceptible to infections.
Oh, no.
And thrombocytopenia means a low platelet count, which increases their risk of bleeding.
So it's like a triple whammy, making them vulnerable on all these different fronts.
Exactly. That's why we monitor their blood counts super closely. We can give them medications to stimulate blood cell production, and we really have to be strict about infection control measures.
The notes mention something called febrile neutropenia. That sounds like a big red flag.
It is. It's basically when a patient with a really low neutrophil count develops a fever.
Okay.
Neutrophils are a type of white blood cell that fight infection.
Right.
So even a slight fever in these patients can mean a serious infection.
Oh, so their immune system is basically compromised.
Exactly.
And a small infection can turn into a big problem quickly.
It can. They need to be hospitalized right away, get broad-spectrum antibiotics and supportive care to stop the infection from getting out of control.
Wow, okay. So nurses really have to be on top of things, watching for these complications and acting quickly.
We do. We're the front line. We're constantly assessing and reassessing, anticipating problems, and advocating for our patients.
So what about skin reactions? I imagine those are pretty common with chemo and radiation.
You're right. Both of those can damage the skin, leading to dryness, redness, itching, and even peeling.
Right. The notes actually use the word desquamation, which just means shedding, right?
Yes, and it can range from mild flakiness to really painful sores. So we teach patients how to take good care of their skin. Gentle cleansers, avoid harsh soaps, moisturize regularly, loose-fitting clothing, stay out of the sun.
Yeah, that sun protection is so important, but it must be hard for patients who are used to being active outside.
It is, but we work with them to find ways to adjust. Maybe finding new ways to enjoy the outdoors while still protecting their skin.
Makes sense. What about hair loss? I know it's not life-threatening, but it must be really tough emotionally, especially for women.
Absolutely. Losing your hair can be devastating for your self-esteem and sense of identity.
Right.
So we acknowledge those feelings and offer resources like wigs, scarves, or scalp cooling treatments that can sometimes minimize hair loss.
I have a friend who went through chemo, and she said losing her hair was almost harder than the physical side effects.
Yeah, it's a very personal experience, and it's so important to validate those feelings and offer support.
Okay, the notes also mention lung problems, specifically pneumonitis, which is inflammation of the lungs.
Right. Chemo and radiation can damage the lung tissue, which can lead to shortness of breath, cough, even respiratory failure in severe cases.
So it's like those treatments are targeting the cancer but causing some collateral damage.
Unfortunately, yes, it's a balancing act, trying to kill the cancer cells while minimizing the damage to healthy tissue. And the lungs are particularly sensitive.
And what about reproductive health? I know that's a big concern for a lot of patients, especially younger patients.
You're right, both chemo and radiation can affect fertility, sometimes temporarily, sometimes permanently. It's a conversation that needs to happen early on, before treatment even begins, so that patients can explore things like sperm banking or egg freezing if they want to have children in the future.
Right. That's a lot to think about.
It is, but thankfully there are resources and support systems to help patients navigate these really difficult issues. Fertility specialists, support groups, online communities, they can all offer some guidance and a sense of hope.
Okay, good. So it sounds like oncology nurses really need to know a lot, from managing physical symptoms to addressing the emotional and psychosocial needs to helping patients make those really difficult decisions about fertility.
It's true. Oncology nursing is a very complex field, but it's also incredibly rewarding. We're there for our patients every step of the way, educating them, advocating for their needs, coordinating their care with the whole team.
Speaking of coordinating care, pain management has got to be a big part of that.
Oh, it's essential. Pain is complex. It's influenced by so many things. Physical factors, emotional factors, even social factors. Our goal is to provide effective pain relief while also minimizing side effects and really focusing on improving their quality of life.
The notes talk about a multimodal approach to pain management. What does that mean practically?
It means using a combination of different strategies to manage pain, tailoring it to the individual patient's needs. We have medications, physical therapy, relaxation techniques, acupuncture, even guided imagery. We have a lot of tools in our toolkit.
It sounds like there's no one-size-fits-all approach to pain.
There's not. We have to be flexible and creative. We work with each patient to find what works best for them.
Okay, the lecture also gets into the psychological impact of cancer,
Right.
which makes sense. This isn't just a physical disease, it's an emotional and spiritual challenge as well.
It is. A cancer diagnosis can just trigger so many emotions: fear, anxiety, sadness, anger, sometimes even guilt. And there's no right or wrong way to feel.
So how can nurses provide that psychological support? Sounds like listening is a good place to start.
Listening is absolutely essential. It's about creating that space where they feel safe and supported, where they can express those emotions openly without being judged. And we can also connect them with other resources like support groups, counseling, spiritual care.
Right, each patient's going to have their own way of coping.
Exactly.
Yeah.
And never underestimate the power of hope.
Mm.
That can be such a powerful force in healing.
So we've talked about the different aspects of cancer care, managing symptoms, pain relief, emotional support, fostering hope. It's a really complex field, but it sounds incredibly rewarding.
It is. And it's always evolving. There are new discoveries happening all the time.
So we talked about what happens when someone is diagnosed and the importance of caring for the whole person. But let's go back to prevention. We've talked about lifestyle changes, but are there other strategies to reduce cancer risk?
Oh, absolutely. Vaccinations, for example, play a huge role in preventing some cancers.
Like the HPV vaccine.
Exactly. The HPV vaccine protects against the strains of human papillomavirus that cause most cervical cancers.
It's amazing how a vaccine can have such a big impact on public health.
It really is. It shows the power of scientific research and innovation.
And the notes also mention chemoprevention. What is that?
Chemoprevention is using medications or other substances to actually reduce the risk of developing cancer.
So it's like taking a medication to prevent cancer before it even starts.
That's the idea. For example, tamoxifen.
Okay.
It's a drug that's commonly used to treat breast cancer,
Right.
but it can also be used to reduce the risk of developing it in women who are at high risk.
Wow, that's incredible. Are there risks that go along with that?
There can be. Just like any medication, chemopreventive agents can have side effects.
Okay.
So it's really important to weigh the potential benefits against the potential risks.
Right. Have that conversation with your doctor.
Exactly.
What about surgical prevention? Is that ever an option?
In some cases, yes. For example, women who have a strong family history of breast cancer
Right.
and a BRCA1 or 2 gene mutation,
Yeah.
they might choose to have a prophylactic mastectomy.
Right.
That's removing the breast before cancer even develops.
Wow. Okay. It's a big decision, but it shows how important it is to understand your genetic risks and explore all the options.
You're right. It's all about empowering patients.
Okay, so we've got lifestyle changes, vaccinations, chemoprevention, even surgical prevention. That's a pretty comprehensive approach to lowering your risk.
It is. And it's not just one thing. It's about making healthy choices throughout your life and staying up to date on the latest in screening and prevention.
It's good to know that you have some control, even if you can't eliminate the risk completely.
Absolutely. Knowledge is power. And the more we learn about cancer, the better decisions we can make about our health.
This has been so informative. I feel like I have a much better grasp on cancer, the different types, the treatments, the importance of prevention, and how complex the care really is. I feel much better prepared for that oncology nursing course now.
That's great to hear.
But hold on, I think we might be missing something. What about after the treatment is finished? What happens then?
You're right. We need to talk about survivorship.
Survivorship, yeah. I thought we covered that when we talked about the different types of cancer.
We touched on it, but survivorship is about so much more than just surviving the initial diagnosis and treatment.
Okay, now I'm intrigued. It's not like everything goes back to normal after the treatments are done.
Unfortunately, no.
So what are some of the challenges that survivors face?
Well, one of the biggest hurdles is dealing with the lingering effects of those treatments. Chemo and radiation, they can be lifesavers, but they can also leave a mark on the body.
Yeah, so I imagine the side effects vary, like depending on what kind of cancer it was, the treatments they used.
You're right. Everyone's experience is different, but fatigue, pain, cognitive changes, what people sometimes call chemo brain, Those are some of the common side effects.
Hmm.
And even an increased risk of developing other cancers later down the line.
Oh, wow. So it's not like you beat cancer and it's over.
It's a whole new chapter with its own challenges. And those physical challenges, they're often tied to emotional and psychological struggles too.
Yeah, that makes sense.
Anxiety, depression, the fear that the cancer might come back, even feeling isolated or disconnected from their old life.
It's like their whole world got turned upside down.
Right. And now they're trying to rebuild it piece by piece while they're dealing with all these other things.
So this is where survivorship care comes in.
Exactly. Providing that ongoing support, the resources to help them navigate this new phase of their lives. Addressing the physical and emotional needs. Helping them thrive, not just survive.
What kinds of resources are we talking about?
Support groups, counseling, rehab programs, maybe financial assistance. Some people find complementary therapies helpful, like yoga, meditation, art therapy.
Wow.
There's a whole network of support out there, something for just about everyone.
And each survivor will have their own unique needs, I imagine.
You're absolutely right. It's not one size fits all. The care plan has to be individualized, really address their specific goals and concerns.
You're encouraging survivors to be active participants in their own health and well-being.
Exactly. We want them to feel empowered, informed, supported, and hopeful.
The lecture notes mentioned a survivorship care plan, too. What is that?
It's a document personalized for each patient. It outlines their treatment summary, any potential long-term side effects, what kind of follow-up care they'll need, and where they can find resources and support.
So it's kind of like a roadmap for after cancer.
Exactly. It can help them navigate that whole world of follow-up care.
The lecture also talked about how certain groups of survivors need extra attention, like younger adults or older adults or people from marginalized communities.
You're right. Different populations have different needs. Younger adult, for example, might be dealing with fertility issues from the treatments.
Yeah.
Which can be really tough, especially if they were hoping to have kids. And body image can be a big concern too, or going back to work after they've been out for treatment.
Right.
Older adults might have other health issues that make it harder to bounce back. And some people might face barriers to care because of their background or circumstances. They might not have the same access to quality services.
It's about being sensitive to everyone's situation, making sure everyone gets the care they need, no matter who they are or what their background is.
Exactly. Meeting them where they are, advocating for them, it's all part of being a good oncology nurse.
This whole conversation about survivorship, it's really made me think about the long-term effects of cancer. It's not just about surviving the initial diagnosis and the treatment. It's about this whole new reality afterward.
It is, and for nurses, it's a privilege to be a part of that. To witness how resilient people can be to help them reclaim their lives.
Well, I think we've reached the end of our deep dive into cancer. We've covered a lot, from the tiniest cells to the biggest challenges, treatments, prevention, even life after cancer. I have to say, I feel way more prepared for that nursing course now.
Me too. And you know what? It never ends. There's always more to learn in this field, always new discoveries.
It's pretty amazing, actually.
It really is.
So any last words of wisdom for our listener who's about to start their oncology nursing journey?
Approach it with an open heart, a curious mind, and be ready to learn and grow. It's tough, but so rewarding. You can make a real difference in people's lives.
And to our listener, remember, every interaction, every little thing you do, every moment of compassion, it all matters. Never underestimate the power of just being there, of your knowledge, your caring touch.
Beautifully said. Never stop learning. Oncology is always changing. New discoveries all the time. Stay curious. Keep learning. You have the power to make a real difference.
I love that. This whole deep dive has been amazing. It feels like the beginning of something,
It is. It always is.
Thanks for coming along this journey with us. Until next time.